All righty. Welcome everybody to this Scope at Lunch, a special edition of the Scope podcast. My name is Paul Hackbarth and I'll be your host for today's webinar. Before we get started, I want to touch on a couple of housekeeping items. First, this Zoom session will be recorded. We'd like to know who everyone is, so please ensure your name is accurate. If you need help with this, you can reach out to us using the chat box feature. And just so you know, I'll be moderating this session with my Phelps Health marketing colleague, Hillary McCash. So one of us will be sure to help you if you need it. Please note that each of you are currently muted. If you have a question that pertains to the topic being discussed, you can add that to the chat box and we'll try to get that question answered for you. You can also have comments in the chat box. One thing to note about the chat box is that you can send questions and comments to the whole group or just one person. We'd encourage you to send your question to the whole group if you feel comfortable doing that, so that way everyone can participate in the discussion. And they also might have a similar question to what you are asking. But if you do feel more comfortable, you're also welcome to send a private question to us. We will be conducting a few polls throughout this Zoom meeting, so you'll get a chance to interact then if you choose. And of course, remember our chat feature. Some of you may be using a mobile device, while others are using a laptop or computer. If you find that your features aren't the same, we just ask that you participate with us in any way you can. And I know also some of you are watching us live on Facebook. And then if you have issues with your sound or anything, the Zoom meeting or other features, again, please feel free to reach out to us and one of our moderators will be happy to assist you. All right, so now that I have that all out of the way, I'm going to introduce today's expert, Johanna Lawrence. She is a certified application counselor with EnrollU here at Phelps Health. Welcome to the show.
Thank you. I'm so happy to be here.
Awesome. Yeah, well, we're really glad to have you with us. Johanna, I think this is your first time on our show. So why don't you tell us a little bit about yourself?
It is, yeah, my very first time. So my name is Johanna. Like you had mentioned, I am a certified application counselor with EnrollU here at Phelps. I am a mom of two. I am a wife. I live in the Dixon area, although originally not from Missouri. I am from the West Coast. So I'm happy to be here in Missouri. I'm happy to be here on the show with you guys. I am fairly new to Phelps Health and this department, so I'm excited to have my first season here of open enrollment within EnrollU and Phelps Health, and really get to help a lot of people this year with their insurance needs.
Awesome. Well, we appreciate you being with us here today, and we appreciate you being part of our Phelps Health EnrollU team. So
thank you.
So before we get into our topic, I thought it'd be good. I'm going to launch a polling question here. I thought it would be interesting just to kind of see from our audience, just so we can kind of get a sense of what type of insurance they currently have now. So I'm going to leave this poll up. You feel free to participate. And again, this is anonymous. So, but if you want to go ahead and fill out that poll real quick here, and we'll share the results here in a couple minutes. Okay. So I'm going to end poll. So it looks like out of everyone that voted, they all have either a private, a health insurance plan offered through their employer or an individual plan. But as you can see, there's obviously a lot of other different options for health insurance. So we're going to talk about some of that here today. So.
Absolutely.
All right, so let's just jump right into the first question, Johanna. What is EnrollU and what services does EnrollU offer?
Yeah, so EnrollU is a department here with Phelps Health. It began in 2013, and it originally was just a department to assist people with the Affordable Care Act, so insurance through the marketplace. Originally, we didn't do Medicare, They started doing Medicare because there was an obvious need for education and assistance surrounding Medicare. And I believe that they started that around 2016. And so that's where we're at now. We help people with enrollment and education in regards to their Medicare and their Affordable Care Act insurance through the marketplace. We are all certified application counselors and as well as licensed insurance producers through the Missouri Department of Insurance. So we have that education and that expertise, that knowledge to really be able to help people navigate through that insurance process because it can be so complicated. All of our services are free. So generally for simple questions, we can, answer those over the phone, but we really like to meet with people one-on-one to discuss their individual needs because like I said before, insurance can be so complicated, but it's also so specific to your individual needs and your family's needs and where you're at in life. And so it really benefits people to sit down with us one-on-one and really go over it all so we can give, the best guidance that we can and help you enroll in whatever it is that you're needing to enroll in.
That's awesome. And like you said, with all these services that you offer are free to people. I did have a follow-up question though. Do you have to be a Phelps Health patient to get services from EnrollU?
Absolutely not. You don't have to be an employee, a patient. You can be anyone in the community. It really benefits us all to have our entire community properly insured so that we're all the healthiest that we can be and everybody's, good to go. So no, you absolutely do not need to be a patient of Phelps Health.
Awesome. That's great to know.
Yeah.
All right. Under our second question, I thought since we were talking about insurance, and this would be helpful, I know for me, since I probably could learn a lot about this too. I thought it would be good to maybe just talk about maybe some common insurance terms, just to kind of get people up to date. So let's kind of just walk through this list, Johanna. Let's start off with, what is a premium?
So a premium is the amount you're going to pay to have your insurance policy generally it's monthly. Sometimes you can pay annually, but generally it's the flat amount that you've agreed to pay to have the insurance policy regardless of usage. So you're going to pay a flat amount every month.
Okay, awesome. All right. And then deductible, I've heard that term. What does that mean?
Yes. So when you have your policy, your deductible is going to be the amount that you are going to have to pay before your insurance plan will start to cover. So generally, this can vary in amount. It can be as low as, a couple $100s to thousands of dollars, but you are going to be responsible for that amount of money before your insurance plan will cover.
Okay, sounds good. And then a copay. What's a copay?
So a copay is a flat amount that you will be responsible for a service or, sometimes for prescription drugs. So if you go to a doctor, they may charge you a flat amount to see to receive that service or to receive that prescription drug. So it's just a flat amount.
Okay. So, and then co-insurance, is that similar to a copay?
It is similar, except for whereas a copay is a flat amount, co-insurance is going to be generally a percentage. So if you have, let's say, an 80-20 plan, your insurer will be responsible for 80% of the cost and you will be responsible for that other 20%
Awesome.
of covered services.
Okay, so that's great. And then out-of-pocket maximum, that's another term I hear when talking about health insurance. What's that?
Yes, I think that this is generally everybody's favorite term. So this is the maximum amount with your co-insurances, your copays, your deductible, all of that. This is the max amount that you're going to be out of pocket for the entire year, the course of a year. So it will reset every year, but for that year, that'll be the total amount that you're going to pay for your healthcare costs. And then after you hit that amount, your insurance company will pay the remaining at 100% coverage.
Awesome. Good information. All righty. Question 3. I guess this is sort of continuing our health insurance terms. What is a pre-existing condition?
So a pre-existing condition is something that you were either diagnosed with or treated for prior to the start date of a policy. So before you got your insurance started, this is something that you already had going on, something that you were already diagnosed with or treated for. Okay.
All right. So we're going to talk more about the different kinds of insurance coming up here, Medicare, Medicaid, the health insurance marketplace. If I have a pre-existing condition, can I enroll in some of these health insurance programs?
Absolutely. So part of the Affordable Care Act was to ensure that people could receive coverage with these pre-existing conditions. So you absolutely can get coverage. The only time, not the only time, but the main time that we see an issue with this is with Medigap plans, so Medicare supplement plans. There are periods of time where you have guaranteed issue rights, so you're guaranteed to get these policies, like your initial enrollment period and things of that nature. However, you may see times where you would have to go through an underwriting process. And so we do see that. However, with Medicare, Medicaid and the marketplace, you are always 100% covered. Like insurance companies cannot deny you coverage for pre-existing conditions.
Okay, all right, that's great information. Thanks. Okay. So on to question 4. I thought we'd kind of start off, I think the first part of this webinar, we're going to really talk about the Affordable Care Act, the health insurance marketplace, things like that. And so a good question to start off with this topic with is, what is the Missouri health insurance marketplace?
Yeah, I know it's kind of like an ambiguous term that everyone uses. Like, what is the marketplace? Do I go there? No, it is a tool, a federal tool that users can use to help them shop for health insurance. So you can go online, put in your information, and it kind of guides you through what plans are available to you. It's also important to note that it's the only tool and the only place where you can get premium tax credits to help you pay for your premiums. So it's a really wonderful, wonderful thing, wonderful tool for our community to be able to get affordable care.
Awesome. So, and then can you briefly talk about what kinds of plans are available in the marketplace? Yeah,
so there's a wide variety of plans. And within Phelps County, we have 2 insurance companies that are participating in the marketplace. That's Ambetter and Anthem. There's those 2. All of the plans offered on the marketplace have to follow minimal essential coverage guidelines. So they're all going to be, they're all going to offer preventative care, immunizations, all of that required stuff. They do categorize the plans based on cost sharing. So they categorize them by bronze, silver, and gold. So bronze plans are going to be less comprehensive in their coverage. Gold plans are going to cover more. But conversely, bronze plans are going to generally be less expensive, and gold plans are going to be a higher premium.
Okay. So sort of a follow-up question. You mentioned that there were 2 available in Phelps County. Does it differ for maybe some of the other surrounding counties around Phelps?
It does.
Okay.
Yep. There are, don't quote me on this, but I think it's Marys County may only have 1 available to them. And then as you kind of get in the area, generally it's those 2 though.
Okay.
In our service area.
Gotcha. Okay. All right. Thanks for answering that. All right. When is open enrollment for the health insurance marketplace? I think it's coming up here shortly, isn't it?
It is. It is November 1st. November 1st it begins, ends January 15th.
Okay.
So we're coming up on it, getting some people covered.
Awesome. So, okay. And then if I enroll in the marketplace during that open enrollment, when would my coverage begin?
So it depends on when you enroll within that period. So if you enroll between November 1st and December 15th, it's going to start January 1st.
Okay.
If you enroll after December 15th, it'll start February 1st.
Okay, gotcha. All right. So it takes a couple of weeks for it to take effect then.
Yep.
Gotcha. Okay. All right. So question 6, who qualifies for insurance through the health insurance marketplace?
So, I mean, a lot of people generally, though, the guidelines are if you don't have an offer of insurance elsewhere, so through an employer, through a spouse's employer, through Medicare, Medicaid, as long as you don't have an offer of insurance there, you qualify for coverage through the marketplace. However, to receive those premium tax credits, like I mentioned earlier, you also have to meet some income guidelines. And I think that we're going to we'll touch on that a little bit later, but it's essentially, if you don't have insurance elsewhere or an offer of insurance elsewhere, you would be eligible.
Okay. Good to know. All righty. So question 7, how do I sign up for the health insurance marketplace?
Yeah, so there's a few different ways. The most common with technology nowadays is to sign up online through the website, healthcare.gov. To do that, you just need to have access to an email, create a login information. You'll need your social security number, your income information, any information about any prescriptions you're currently taking or providers that you're currently seeing, so you can make sure that those are in network with the plan that you choose. So yeah, the other option would be to call the marketplace, and they have people that can assist you over the phone.
Okay, so, and if somebody were to contact you or the EnrollU team, you guys can also help assist with them applying for that. Or
Yeah,
signing up.
absolutely. So we can walk you through, doing it online together, or even over the phone if you prefer that way. But generally, we do help people online. Mhm.
Okay, awesome. That's great. All righty. So this next question is, if I already have health insurance coverage through the marketplace, do I need to reapply each year, or does my coverage roll over into New Year's?
So it can roll over. You can have the option to have it re-enroll you if that plan that you were on this year is also being offered next year. So you don't necessarily have to reapply every year. However, it is best practice to go online and review your application every year. Make sure that your income information is the same. Make sure that you're still happy with the plan that you're on. Make sure that there's no better options that are available for you. So it's kind of, one of those situations where you don't necessarily have to, but really it's best if you get on and go through that every year.
Awesome. So, okay. So, you kind of alluded to this next, I think the answer to this next question, can I change plans during open enrollment? It sounds like this is actually a great time to maybe look at changing plans if that's something you want to do. So.
Yeah, absolutely. I absolutely encourage everyone, if you are getting your coverage through the marketplace, to at least go on and see what's available. These plans change every year. So maybe you have the best plan this year for you, but maybe now there's a new one and that fits your family's needs better.
Yeah, that's amazing. So I just want to point out in the chat box, Hillary is my great coworker. She's got some information and links there about signing up for the healthcare.gov website you mentioned, and EnrollU number and email there too. So check that out if you need some more information. So. All right, Johanna, you talked about this earlier, premium tax credits. I've heard that these can lower my insurance costs. So can you kind of talk about what are premium tax credits and who qualifies for them?
Yeah, absolutely. So premium tax credits are just like they sound. They're a tax credit from the federal government that help you pay your insurance premiums. You can choose to receive them one of two ways. You can choose to receive them in advance, so they will pay them monthly directly to your insurance company, or you can choose to receive them when you file your taxes at the end of the year. Generally, we don't see people use that too much. It doesn't really, if it benefits you one way or another, but we generally see people receive them as advanced tax credits monthly. And the guidelines for that are income based. So generally in years past, you have had to have income between 100% and 400% of the federal poverty level to receive premium tax credits. With the expansion of Medicaid, that kind of bumped up the short end of it to 138%. So if you make less than that, you're going to qualify for Medicaid, which will make you ineligible for premium tax credits. And then they also bumped this side out. So from 400%, they're now saying that individuals above that limit, because of the American Rescue Plan, may also receive tax credits. So essentially, if you make over 138% of the federal poverty level, you are eligible for tax credits. And that was, like I said, and that's, I think, through 2025, they've extended that. So normally it's that 138 to 400, but we're looking at higher on this end. So that's great, because it opens the door for a lot of people who maybe just on the far end of receiving that tax credit, have that available to them. And the other thing I was wanting to mention too is they also, just a couple of days ago, the Department of Treasury revised, I don't know if you're aware of what the family glitch was. So it's a part of the marketplace that where it says that if your individual plan through an employer costs less than 9.5, I think it actually was 9.6% of your household's income, it's considered affordable. That didn't take into account if I had a family and what the cost for my family's coverage would be. So that kind of put a lot of people in a bad spot where, okay, my individual plan is affordable, but it's not affordable to add my husband and my kids to this plan. And they were no longer eligible for tax credits because they had an offer of affordable coverage. So they fixed that as of 2 days ago to include the family as well. So if my family's coverage is less than 9.5% of my household income, then it is considered affordable and I wouldn't be eligible. But if it's higher than that, then I can get premium tax credits for my family through the marketplace. So I wanted to mention that because especially in our area, school teachers especially is where we notice this. They may have extremely low individual plans, but it's incredibly expensive to insure their families. And so they've been in this situation where they've not been able to get help with those premium costs. And now with this starting in 2023, they may be eligible for that help. So I wanted to make sure people were aware of that change.
Awesome. That's great. Yeah. Thanks for sharing that timely update. Yeah. All right. So now I think we're going to sort of switch gears and talk about Medicare. Johanna, can you just briefly explain what is Medicare?
So Medicare is a federal health insurance for those age 65 and older, individuals with long-term disabilities, or those with end-stage renal disease. So it's a federal insurance.
Okay. All right. So, and when we're talking about Medicare, you often hear about Medicare Parts A, B, C, D, all these supplement plans.
Go down the alphabet.
Yes. Okay. Can you kind of explain the different parts of Medicare?
Yeah, absolutely. So we'll just start from the top. So Part A is your hospital coverage. It's going to cover things like inpatient hospital care, any kind of, admissions to the hospital, skilled nursing facilities, hospice, those types of things. And then Part B is going to be your medical care. So it's going to cover things like your doctor's visits, outpatient care, lab work, that type of thing. And that A and B is what we consider your original Medicare. Okay. And then comes Part C, which is where it kind of starts to get a little more complicated. So Part C is a Medicare Advantage plan, which is also known as Part C. It's not an official part of Medicare. These are plans offered by private insurance companies. And essentially how it works is you forego your original Medicare to have your Medicare handled and managed by a private insurance company. So Anthem, WellCare, United Healthcare, Humana, those types of companies. And so you can choose to get, instead of getting it through the federal government, managed by the federal government plan, you can choose to have that managed by a private company. It's not a requirement, obviously, but you can choose, original or Medicare Advantage. Part D would be a part of original Medicare. So you add it onto your A and B, and it's probably the easiest one to remember, D for drugs. So it's your prescription drug coverage. So you have that in addition to that A and B. Now, Medicare supplement plans. So your original Medicare A and B will generally cover about 80% of your healthcare costs. So that leaves you with 20%. Medicare supplement plans are designed to cover that cost, right? So there's plans A through N. The most popular is G because it covers the most. It covers all but your Part B deductible. And those will cover that additional cost that you have from that A and B.
All right, awesome. So
yeah.
Thanks for walking through that alphabet soup of
Medicare. This is why we meet with people, because it's hard. There's a lot involved with it.
Yeah, definitely. So. Okay. So my next question is, we've also heard about Medicaid too. I was wondering if you can kind of tell the people watching and listening to this, what is the difference between Medicare and Medicaid?
Yeah, so Medicare, like I mentioned, it's a federal insurance. You qualify based off of your age or any kind of disabilities that you may have. And there is that cost sharing aspect of it. Like I mentioned, that 80%, 20%, you're responsible for a portion of your healthcare. Medicaid, on the other hand, is state and federal coverage. And you qualify primarily based off of income guidelines. And usually there's no cost sharing. So sometimes there will be some premium parts of that, but generally there's no cost for you as far as the Medicaid.
Okay. Sounds good. Thank you. All right. You kind of answered the first part of this question for Medicare. That was for 65 and older, and then I think there's some other criteria that people could meet for that, correct? So. Yeah.
So if you are disabled for 24 months or longer, so on Social Security disability, or you have end-stage renal disease, that would also qualify you for Medicare.
Okay. All right. So, okay. So how would somebody who falls into those categories, how would they initially sign up for Medicare? And then also, when would coverage begin after they sign up? So,
Yeah, so for the Part A and B, you would sign up through the Social Security Administration. So you'd go down there, sign up through them for any kind of Part D plan, prescription drug plan, or Medicare supplement plan that you may want to participate in. You would sign up directly through the provider. And that's where we come in. Obviously, we don't work with the Social Security Administration, but we can help kind of guide you through that Medigap, that Medicare supplement plan, and that Part D, and get you in touch with the people that you want to need to be in touch with to choose to start the plan that you choose. So you just sign up through them. And then as far as coverage goes, when you're initially enrolling, you have this 7-month window to enroll. It's 3 months before your birthday month, the month of your birthday, and then the 3 months after. And so just like that last one, it really depends on when during that period you sign up. If you sign up during the 3 months prior, your coverage is going to start the month of your birthday, the first of the month of your birthday. If you sign up after that, it'll be the first of the month of the following month. So if you sign up the month of your birthday, it'll be the first of the month of the next month, and then so on until you've passed that window.
okay, awesome. So, that was a good explanation.
Thank you.
All right. Johanna, another question I thought a lot of people might have is when I turn 65, do I have to enroll in Medicare?
You do not. So as long as you have other creditable coverage, you do not have to sign up. And technically, you don't have to sign it up at all. But if you choose to not sign up without creditable coverage, so something through an employer, spouse's employer, or something of that nature, you would be subject to penalties when you do decide to go to sign up in the future. Now, Part A is generally free. As long as you've worked 40 quarters in the United States, that Part A is free. So if you're still working, I at least encourage you to sign up for that Part A, get that benefit. It doesn't cost you anything. At least get that going while you decide whether you want to get that Part B and those other parts going.
All right, awesome. So I didn't know about that stuff. So that's great.
Yeah, and they can be pretty substantial. Like the penalty for Part B is 10% for every year that you had the opportunity to get coverage but didn't. So it's important to either sign up for Medicare or have some other type of creditable coverage going for yourself.
Okay, so just to clarify, that penalty would not apply. So say I turned 65, but I continue and my employer offered health insurance and I continued staying on there, that would not apply.
Exactly.
Okay.
Yep.
Okay. All right. Nope. So all right, we'll go back. So. All right, question 14. All right, so we talked about the health insurance marketplace for the Affordable Care Act open enrollment. When is Medicare open enrollment? I think the dates are a little bit different. So.
Yeah. So we just coming up on it in a couple days, October 15th through December 7th. So we are just about to hit it. And that's when you can change your Medicare Advantage plans. You can change your Part D plans, or you can switch from Medicare Advantage back to original Medicare or vice versa. So that's what you can do during that time period.
Okay. And just like when we talked about with the health insurance marketplace, this open enrollment for Medicare is probably a good way to see, or a good time to see if maybe something, like you said, something has changed in your life, or maybe there's like you said, maybe you guys can help them find a better plan or whatever that may be. So.
Yeah, and that is particularly notable for your Part D plans because, our prescriptions change every year. And again, like if the plan that you're on this year may not be the best plan for the prescriptions that you're currently taking. So it's important to get on there, at least just review the plans available and see if, there's something better for you this year.
Okay. We're just rolling along here. So I do want to remind everyone, again, we do have that chat box feature. If you guys do feel comfortable or have any questions as we're going over these topics. I know I probably have a lot more questions I could ask Johanna about insurance. I could be here all day. So, but we really encourage you guys, like I said, this is your chance if you do have any questions to ask those. So, all right, question 15. What are the major Medicare benefit changes for 2023?
Yeah, so there's three main ones that we're seeing. The first is we're going to see a decrease in the Part B premium and deductibles. So 2022 premium for Part B is $170.10. For 2023, that's going down for the first year in a while to $164.90. And then the deductible is going down from $233 to $226. So that's wonderful. I'm sure people are very excited about seeing that go down instead of up. However, on the flip side of that, we're going to see an increase in the Part A premiums or no, it's not premiums, deductibles and copays. Not a huge substantial increase, but there will be increases there. But the most exciting part of this is that we are going to see a cap on insulin charges. So for the patients that have diabetes, your insulin through your Part D plan is capped at $35 a month per insulin. So if you're on multiple, it could be more than $35 a month. So that's incredibly, incredibly important because insulin can be so incredibly expensive, and it's exciting to see a cap on that. And my coworker Steve just, talked to the diabetes support group the other day and heard nothing but great news about that. So everyone was thrilled to see that cap there. So that's the most noteworthy change that we're going to see this coming year.
Awesome. Yeah, that like you said, that is great news about for those diabetes patients. Yeah, because I too have heard. Yeah, those are.
I'm just waiting to see it expand outward from Medicare, so into the marketplace and stuff, so everyone can get help. But this is great for now.
Yeah. So yeah, great first step. So.
Yep.
Okay. All righty. So, so in addition to these open enrollment periods we were talking about, there's also special enrollment periods. So I was wondering if you could talk about what is a special enrollment period and who qualifies for these?
So a special enrollment period is just a time outside of open enrollment or general enrollment that you can make changes to your coverage. And it takes place for Medicare as well as Marketplace, although the criteria are a little bit different for each. But essentially, it's going to be something that's triggered by an event. So maybe you move outside of the service area, or you lose coverage, or you become eligible for other coverage. Those types of things will trigger a special enrollment period where you can make changes to the plan that you're currently on.
Okay. I think also certain life events, maybe if you get married or have kids too.
You can with the Marketplace in particular, if you get married or have a baby, those are definitely triggered special enrollments. Mm-hmm.
Awesome. Okay. All right. So I think we're about wrapping up here. So Johanna, how can I learn more about EnrollU services, and how can I contact an EnrollU specialist for assistance?
Yeah, so generally the easiest way to reach us is by phone. We're readily available. Our phone number is 573-458-3676. And we can answer any questions that you might have over the phone. You can also find us on phelpshealth.org. So we've got a webpage on there that gives you a lot of information about the department and insurance in general. And you can also email us. So enrollU@phelpshealth.org.
Awesome. Yeah. So, and as I said, Hillary put that information in the chat box earlier there. So
awesome.
So I'm going to throw up another polling question here. And this was just we just kind of wanted to talk to our audience here. How would you prefer to receive information about EnrollU? Obviously, we're doing this Scope podcast, and but we do a lot of other places or have a lot of other ways to get the information out. So I'll give that a couple minutes for people to chime in.
I know that Steve and Kevin were on the Ask the Professional with the radio this morning. So hopefully everyone on here got to listen to them on there, because they're a wealth of great information.
Yeah, that is great. And we'll, if you did miss that this morning, we'll share that on our social media pages later. So you can still listen to that again. So. So we can have a good mixture here. So website, radio podcast, flyer, brochure, and other. Okay, so that's good information to know. So.
Absolutely.
Awesome. All righty. So we do have some time for some participant questions. I haven't seen any come in yet. So I'll give you guys, if you do think of anything, I'll give you guys a couple minutes to think of that. And Johanna, if there's anything too that we didn't cover or you'd like to just mention, you can also have the floor now too.
Oh gosh, put me on the spot. I mean, we really covered it all. I just want to stress the importance of, really come in. If you have any questions at all, don't hesitate to call us or schedule a time to come in, because that's what we're here for. Steve in particular, he's very passionate about making sure that everyone has a good base understanding of what they're going to do, especially with Medicare, but with all insurance in particular, because we see a lot of situations where there's just a lack of knowledge about these situations because they're so complicated, and it can really lead people to making bad decisions for themselves financially or otherwise. And so I just encourage people to reach out, or if you know of anybody who could use some assistance, parents or children or nieces or nephews, just give them our phone number, have them reach out. Our services are free, and we are very passionate about helping people make, good decisions for themselves.
Yeah, it's great that we have that you guys offer this service in the community. And yeah, just to echo what you said, yeah, insurance can be very complicated. I will attest to that too. So it's great to have, like you said, you and Steve there. Kevin, we might also want to mention him from your team. He helps a lot of our patients at the Delbert Day Cancer Institute as well too. So
yep, he's our financial navigator, part of the EnrollU team, and he's wonderful. He helps people when really they need it the most. Cancer is like one of the worst times of your life, and he's down there helping people. So he's also very passionate about that, and can meet with him too.
Okay. It looks like we actually did have a question here real quick, coming from Carolyn. So she's asking, you stated that after the out-of-pocket maximum is met, the rest is paid at 100%. Is this everything or just covered services?
So covered services. So if it's something that your plan would never cover, they're not going to cover it. But if it's part of a covered service, will pay it at 100%.
Okay. All right, great question. Okay. All righty. Well, if there's any more else, yeah, Hillary, thanks for putting up that the website to our EnrollU page on our phelpshealth.org website, so you guys can go there and learn more. And as we said earlier, we have the contact information in there to get a hold of Johanna, Steve, and the team there. So I'm going to go ahead and wrap this up. So again, thank you guys all so much for tuning into the Scope at Lunch. And a huge thank you to Johanna for joining us today. We really appreciate all the insight you've been able to share with our community.
Yeah, thank you for having me.
Awesome. So as a reminder, this show has been recorded and it will be emailed to participants. So it can also be rewatched on our Facebook page. So if you did miss it or your friends missed it and you want to let them know about all the great information that Johanna shared with us today, they can go watch that on our Facebook page. So and if you do like our show and want to know more, you can check out other episodes of the Scope at Lunch and Scope podcast on our YouTube page or phelpshealth.org. And with that, have a great afternoon, everyone.
Thank you so much, Paul.
Thank you.